a pen and paper beside you, and you can write notes. Okay, so just write down notes for your own purpose. Okay, so I'll just start with the definition of the anatomy, and I'll highlight for you important things. Okay, so and something that you can also type. Okay, so when we talk about anatomy, we're talking about the structure. Okay, so we're talking about the structure. Okay, and the different parts that is included in this anatomy. So structure means a physical structure. Okay, so it's like nose, ears, okay, your legs, your feet. So notice I'm still using a very layman's term. Okay, so your ears, your nose, your legs, your feet. But as we start learning anatomy, we have to use the anatomical term. So anatomy is just learning a new language, okay? So unfortunately, there are still people who are coming in. We're already halfway through our class. So again, I just want to emphasize, please come on time, okay? Face-to-face, you're already late. And then online class, you're also late. Okay, so if you are not able to, and the thing is, we've already asked you yesterday who will go for the 10 a.m. Okay, so again, please be responsible to come on time. Okay, so it's not because it's online you can be late, but if you're late and you miss half of the class, that's also, I mean, it's your responsibility to catch up. Okay, so again, I don't want to be frustrated, but you know, I can't help it if there are people who are still joining the Zoom like halfway through our discussion. Okay, so if you're already late for 30 minutes, please don't even come. You come to the evening class because it will be for not for your benefit. Okay, anyway. Okay, so again, when we're talking about anatomy, we're talking about structure. Okay, when we're talking about physiology, we're talking about function. Okay, so function means what is the function of your feet, what is the function of your legs. Okay, so it's difficult to separate anatomy from physiology. They always come together. Okay, but again, okay, if this question is asked in your midterm, just remember for now or revise this topic, anatomy is the structure, physiology is the function. Okay. Okay, so I have this picture of a systemic anatomy. This is mainly a picture of your digestive system. Okay, let me skip this slide first. I'll go to the slides where I can talk about all the different parts or the different system of anatomy. Okay, so I'll just skip, don't worry. I'll just find that slide where, yeah, okay. So for those who have the manual, you can flip to towards the end, and this is the general system of your anatomy, okay? So if you're doing the degree program, usually we discuss per system for about 1 or 2 weeks. That's why it takes a year to finish this, okay? So again, we're doing a concise version. For us, I think what is important for nursing aid is that we know about the skeletal system, because if we're dealing with patient with fracture, then it's very important that we know the basic names of the bones. Okay, so if you see in the clinical notes, or the patient has fracture, okay, on the right humerus. Okay, so maybe what is humerus? I've never heard it before. Okay, so or a fracture on your right femur. Okay, what is that? Right. So I'm starting to sound maybe Spanish or Greek to you that you don't understand, but you know, the more that we study anatomy, the more that we realize that we're learning a new language. Okay, just shout out there. Okay, to Nora and Belle, you came so late. Okay, hopefully you still learn something. Okay, so please get an update from the team about what I discussed earlier. Okay, so for the skeletal system, as I mentioned, I have a slide or additional slides to point the must know. Okay, muscle, not so much. Maybe we talk about the big muscles. Okay, reproductive. Okay, this is the when we talk about uh, the uterus. Okay, the penis, the ovary. This is part of your reproductive system. Your urinary system basically is your kidney. Okay, your ureters, your urinary bladder. Okay, so again, if these are all coming to you like a foreign language, don't worry. Okay, we will talk about it in a while slower. Okay, I'm just giving a general view to everyone. Respiratory, I think this is the in thing now to talk about because of COVID. Okay, so we talk about our lungs. Okay, probably you've heard that people who go for tests for COVID, you go for nasopharyngeal test where they insert a small um, cotton swab up to your at the very end of your nose or at the very back of your mouth. Okay, that's your nasopharynx. Okay, and that is part of your respiratory system when you talk about the nose or nasal or nasopharyngeal. Okay, the slides that was at the beginning was digestive system. When we talk about lymphatic, okay, when we talk about the lymphatic, we're talking about our immune system. Okay, so these are your lymph node. Okay, these are your lymph nodes. Okay, and cardiovascular, um, when we talk about the heart, when we talk about your blood vessels, okay, when we talk about arteries and veins. Okay, so I think pretty much we've covered. Your nervous system is the one that is involved in your sensation. When you feel pain, that is nervous system. Okay, if you feel any sort of discomfort, that is your sensory function. Okay, so as I mentioned, we'll focus first in the skeletal system and I'll go into detail. So please revise this. Okay, you should know the different system. Okay, sorry, I missed this part, integumentary system. This is basically the skin. Okay, the skin, in a way, this is the biggest system in terms of covering the surface area. Okay, so the skin or integumentary system is the biggest system. Okay, and without our skin, we are more susceptible. If I mean susceptible, means that we are more prone or we are more likely to get infection if we don't have intact skin. So what I mean by intact is that if you have any laceration or any wound, an open wound, that is an entry point for the bacteria to come in. Okay, so always make sure that you have intact skin. Okay, if you have any laceration, sometimes when we're preparing food, okay, then we accidentally cut ourselves. Okay, so we have to disinfect that and cover it. Okay, because we are running the risk of bacteria, and we have bacteria in our hands, in our skin all the time. These are our normal flora, and if you are more exposed to the environment, then there are probably more bacteria that are just in your skin. Okay, so the moment that there's an opening or a cut, it can come in. Okay, so just take note of that. Okay, so before I move to the skeletal, I just want to summarize this again. Integumentary, your skin, okay, the biggest system in terms of surface area. Your skeletal, where we talk about your bones, okay, bones. When we talk about your bones, okay, your muscle, okay, the one that allows you to smile, allows you to frown, okay, your facial expression, okay, like for me, I get like stressed a little bit when students are late, so all my muscles are sort of frowning, so that's using some of my facial muscles. Okay, as I told you during the briefing, I'm generally a happy person, so I like to smile. So when you're smiling, you use more of the muscles of your facial muscles compared to your frowning. So try to smile as much as possible. So those who are really worried about wrinkles, okay, we have to exercise our facial muscles, and one good way to exercise our facial muscle is to smile more or to laugh more. Okay, crying use less muscle. Okay, so you tend to have more wrinkles. Okay, if you're always in negative vibe or negative mood. Of course, crying also can be therapeutic. Okay, but I'm just saying, just to exercise more of your facial muscle, that would be laughing or smiling. Okay, your muscles, your bicep muscles when you do exercise, your tricep muscles. Okay, so normally those muscles, the one that we will discuss are bigger muscles like your bicep, your tricep. Okay, those who are into bodybuilding, normally they have a very big uh, chest muscle. Okay, these are your pectoralis muscles. Okay, and those who are into um, like really strenuous exercise and consistent exercise, then they have their six packs. Yung what do we call? Pardon for the non-Filipino in this class. For Filipino, we call it yung may pandesal, right? So those are muscles, okay, that you develop also by doing continuous exercise, and those are your rectus abdominis muscle. Okay, if you don't get it, don't worry for now. Okay, so I'm just going through this muscle. And then your big muscles on your legs, those who are doing squat, okay, those muscles are your femoris muscle, okay? Actually, the biggest muscle is your butt muscles, your buttocks, okay? And we call that gluteus muscle. Okay, so I'm giving too many things, and I don't want to stress you out yet. Okay, so I'll try to slow down. Okay, so nervous system, again, basically this is your brain and spinal cord. Okay, brain and spinal cord. Okay, this is your brain and your spinal cord. Okay, so your endocrine system, these are in related to your hormones. Okay, so if you're writing down notes, endocrine system is related to your hormones. H-O-R, okay, Hormones, hormones. Okay. Your cardiovascular is your heart, okay, and your artery, heart and artery. Okay, let's stop there for now. Okay, your artery and your heart. Okay, so of course, blood is included in the cardiovascular because it's the one that is circulating. Okay, lymphatic. Okay, just I want you to remember for now, lymph nodes. Okay, lymph nodes. That's L-Y-M-P-H. Okay, L-Y-M-P-H, and nodes, N-O-D-E, nodes, lymph nodes. Okay, and then digestive system, we talk about the mouth, okay, stomach, your intestine, your anus. Okay, so I just summarize it for now. Okay, but I'll go into detail. For respiratory, basically your lungs, your nose, lungs, your nose. Okay, trachea, I'll talk about that later. Okay, and then your urinary system would be your kidney. Okay, your kidney and your urinary bladder. Okay, so urinary bladder is like the storage for your urine. Okay, and then reproductive system, basically for women, this is your ovary or ovaries. Okay, because normally female would have two ovaries unless one of the ovaries is removed or both of the ovaries are removed. For some medical condition, sometimes we have to remove the one of the ovary or both of the ovaries. Okay, if there's any ovarian cancer or cancer of the ovary. Okay, so for male, the organs for male, if it's reproductive, it's normally just the prostate and the penis. Okay, so prostate and the penis. Okay, so as I mentioned, I'll go to the skeletal system. Okay, so for the bones, okay, so the thing that you have to remember, okay, is skull. Okay, mind you, if you go for more reference or if you look in more details, the skull, okay, has many other small bones, okay? But again, since we're talking about general anatomy, okay, we'll just label it under skull, okay? But if you go for advanced class, okay, we will talk about like the frontal bone, the parietal bone, temporal bone, occipital bone. Again, don't need to remember the last uh, the four bones that I just mentioned, but this is for advanced class. For now, just remember skull. Okay, this is the bones that protects your brain. Okay, skull. Okay, and this is next one is humerus. Humerus is very important because maybe your employer or your alaga or somebody that you're taking care of, okay, when they're running around, especially if you're taking care of kids, they always want to run and they suddenly trip. Okay, humerus is one common, okay, that gets injured. Okay, so we have to know the anatomical term. Okay, the term is humerus. Okay. Okay, another bone that I want to emphasize would be your radius and ulna. Similar, okay, radius and ulna. So you have your upper arm, which is humerus, the bone inside is humerus, and then your lower arm, there are two bones here. So here it's one bone, okay? Here it's one bone, but in the lower arm, it's two bones. This is your radius and ulna. So how do I remember where is radius and where is ulna? Okay, so you have your thumb. If you make this gesture or you make this, the one that you are seeing in the camera, I make it small r. Okay, so this r, if you follow it down, so this portion closer to your thumb, which is letter R, I made it an R shape, small letter R. This is your radius. Okay, so you can feel the bone. Try to feel the bone. There is a bone there. Okay, that is your radius. Okay, so your guide is your thumb. Okay, on the other hand or on the other side, I mean, okay, this is your ulna. You can feel the bone there. That's your ulna. Okay, you go down here. This is your ulna. Okay, so how do you remember ulna? Uh, with your ring finger, okay, and your pinky, okay, or your now I'm a bit hypoglycemic. I can remember. Okay, anyway, your ring finger, okay, and your little finger here, okay, you make a letter U. That's ulna. Okay, so this is the ulna. Okay, but that's just point of reference. Okay, as long as you know that this is radius, this is ulna. Okay, so sometimes if our accent are very strong, you know, Filipinos, we have very strong accent with P and F and U. Okay, so ulna. Okay, but it's yeah. So if you can relax on the accent a little bit, it's ulna. Okay, so ulna and radius. Okay, so far we have the skull, we have the humerus, we have the radius here, and we have the ulna. Okay, and next muscles that I want to emphasize is your femur. Okay, this is your femur. This is the longest bone in your body. Okay, so write it down. Your femur, F-E-M-U-R, femur is the longest bone in our body. Okay, longest bone in our body, femur. Okay, and just going faster a little bit, your that is your thigh. Okay, not the nationality or the food that you want, like the food that you want to eat. That's sounds similar, but what I mean is thigh. Okay, T-H-I-G-H. Okay, or T-H-I-G-H. Okay, I guess in American English it's H, but British English I think they pronounce it as H. So it's pronounced, it sounds like Thai, okay? Not like Thailand, okay? But it's spelled as Thai, T-H-I-G-H. Okay, so your thigh, it's a big portion. Okay, we call that femur. The bone that inside, okay, is your, so when you ask thigh bone, that is basically your femur. Okay, femur. Okay, and the bones of your legs, I wouldn't make this a must know, but you can just review fibula and tibia. This is in your lower leg. Okay, tibia and fibula. And the last bone I want to talk for today is your ribs. Okay, your ribs basically protect your heart and lungs. Okay, so these are your ribs. These are rib cage. So there are 12 sets or 12 pairs of bone. Okay, so you can add that. Ribs are 12 pairs, 1, 2. Okay, so these are 12 pairs of bones that surrounds your heart and lungs and protects it. So this is your ribs. Okay, RIBS. Okay, so please revise the bones. There are 206 bones, okay, for adult. I'm talking about adult, okay? 206 bones in our body. So far, I've only discussed 1, 2, 3, 4, 5, 6, 7, 8. 8 bones, okay? So those 8 bones are must know because they are normally, in terms of fracture, clinical notes, we have to know this. But if you want to learn more bones, so please let me know, okay? Let me just switch off my phone. Okay. Thank you. Okay, so then I'll go to the previous slide. Okay, so digestive system. This is a digestive system. I'll just talk about your uh, mouth. This is your mouth. Let me switch on my pointer. Sorry about that. Give me a second. All right, let me stop this first. Hold on. Let me share it again. Okay. Now, I don't know what you are seeing. You can see my slides, right? Yeah. But then, that's your part. Okay, so just want to focus here. Your mouth, okay, your esophagus. This is your esophagus. Okay, this is the passageway of food from your mouth until it reaches the stomach. Okay, so this is your stomach. This is your intestine, and your intestine are separated into small and large intestine. And the very end of your digestive system is the anus. Okay, so the very end of your system, of our system, is the anus. Okay, so please revise this digestive system. Let me go to the muscle. Uh, Let me stop again. Okay. Okay. Hold on. One more try. Okay. Yeah. Huh? Okay. So muscles, as I mentioned, you have your facial muscles, okay, that are found in your face. You have these muscles here, that one I'm pointing right now. This is your pectoralis muscle. Pectoralis muscle. That is how you spell it is Pectoralis. Okay, pectoralis muscle. Okay, let me see if I can write from the screen. Okay. Pectoralis. pectoralis muscle. Okay, so pardon my handwriting. Pectoralis muscle. Pectoralis. Okay, so this is your pectoralis muscle. This is your chest muscle. Okay, another important muscle. So that's your pectoralis muscle. Okay, this one. Another important muscles is here. Okay, in your upper arm. This is your bicep. Okay, this is your bicep. Okay, bicep. How do I spell it? B-E-I-C-E-P. Okay, bicep muscle. Okay, so B-I-C-E-P. Depending on whether you write Latin or English, you can also write biceps. Okay, bicep muscle. So these are your muscles here. Okay, which helps you to flex your elbow. Okay, so this is flexing your elbow. Okay, so from here, I do this. This is flexing of the elbow. This is by your bicep muscle. Okay. Okay, another big muscles here in your butt. This is your gluteus muscle. Okay, so Gluteus, gluteus muscle. Okay, these are your butt muscles. B-U-T-T. Okay, butt. This is short for buttocks. Okay, but the muscle is called gluteus muscle. Okay, so there are many muscles more that we need to know. Okay, but I think for now, okay, I have to teach this because we give injection here. Okay, so now deltoid, D-E-L-T-O-I-D, deltoid. Okay, so D-E-L-T-O-I-D, deltoid muscle. This is your deltoid muscle here. If you want to touch it, so you can remember it, this one on my left and also this one on my right. This is your deltoid muscle. Why did I talk about that? Because it's clinically it's important to us because we give injections here. Okay, especially for adult, we give it here. For babies, because their muscles are not yet developed in the deltoid, we give it in the gluteus muscle in the buttocks. Okay, so those and sometimes we also give it in the thigh muscle. Okay, in the thigh muscle. Okay, so again, very important clinically, deltoid muscle. Okay, the gluteus and quadricep muscles. Okay, so quadricep muscles. Okay, apologize, I have to add more because this is clinically significant for us. Quad. Okay, quad means four, right? So it means four muscle together. Quad, R-I-C-E-P-S. Okay, quadricep muscles. Okay, so for the muscle, for now, okay, for now, because again, I mean, this is a concise anatomy. The four muscles that you remember are chest muscle, pectoralis muscle, okay, your deltoid muscle, okay, for injection, your bicep muscles, okay, your quadricep muscles, which is the muscles of your thigh, and your gluteus muscle, which is the muscles of your buttocks. And this is muscles of your buttocks, and we give injection through gluteus or through deltoid or through the quadriceps. Okay. Okay. Directional terms. I let you revise this on your own. It's just when we just say anterior means in front, posterior means back. Okay. So anterior means front. Okay, so I'll highlight here. Anterior means in front. So posterior is the back. So if I say, where can I find your face? That is anterior. So instead of saying in front, that is layman's term, we say anterior. Okay, so somebody is already yawning, sleepy at 11 in the morning. Okay, drink your coffee or your tea. I can see everyone. Okay, so yeah, it's okay. It's okay to yawn. Yeah, so hopefully you have a coffee or something to drink. uh, beside you. Okay, again, anterior means front, posterior behind. Okay, superior means on top. So if I say the head is superior to my feet, okay, superior means on top, inferior means below. Okay, so we use this in terms of describing uh, um, cases of our patient first, or describing where is the fracture or where is the wound. Okay, so I'll leave it here for now. Anterior, posterior, superior, inferior. Okay, so superior means again on top, inferior means below, anterior means in front, posterior means behind or at the back. Okay, so you can see here, what else should I, okay, maybe I have to add this. Medial means in the middle, okay, and lateral means on the side. Okay, lateral means on the side. So medial is here, my mouth is medial, it's in the middle. But my ears are lateral. Okay, my mouth is medial. So instead of saying middle, it's medial. My ears, because it's on the side, it's lateral. Okay, so when you revise these slides, just remember the 6: anterior, posterior, superior, inferior, medial, and lateral. Okay, so I'm aware of the time, so I'm exceeding it. So please bear with me. Okay, these are some of the movement. Okay, so let's just again focus on flexion. Okay, flexion and extension. Okay, so flexion, I'll just give you an example. So you can do it in different parts of the body. Flexion is when you reduce the angle. Okay, so this one is flexion. But if I do the opposite movement, that is extension. Okay, so some of you, if you are in your room, you have your privacy, you can do this. Okay, so you remember this is flexion. When I do the opposite movement, okay, look here. If I do the opposite movement, this is extension. Flexion, extension. Flexion, extension. Okay, so so if we're talking about the head, okay, let me rotate a little bit. This is flexion, and then this is extension. Okay, so flexion, extension. Okay, so there are different movement here: rotation, circumduction. Okay, please revise this. Okay, so but for now, I require you to know flexion and extension. Okay, body cavities. This only means these are the space where you can find the organ. So when we say cranial cavity, it means it's a space. Okay, so it's like a cabinet. It's empty, right? So what is in your cabinet? Your clothes, okay, or yeah, your clothes, or your jewelry is inside the cabinet. So the cabinet itself is a cavity. So when I say cranial cavity, this is the house for the brain. Okay, so when I say abdominal cavity, it means it's the space for your stomach. It is the space for your digestive system. Okay, so if I say thoracic cavity, it means it is the space for your heart and lungs. Okay, cavity. How should I make it easier? Remember, if you have a tooth cavity and it's very painful, you have a tooth cavity, means that there is a hole, okay, in your in one of your tooth, right? Okay, or if you have many tooth cavities, then you can have many holes in your teeth. So it's a hole. So this is a space. Cavity is a space where you can find the organ. Okay, so cranial cavity, thoracic cavity, abdominal cavity. Okay, this is my last slide. I just want to focus lastly on the respiratory system. Okay, in the respiratory system, okay, the structure, I don't have a picture here. Okay, I can add that later on, but just remember, because again, in COVID time, your lungs, Okay, we have two lungs, left and right. Okay, but the tube from our mouth and nose all the way to the lungs, that's what we call trachea. Okay, that's what we call trachea. So I'll just write it here. Okay, trachea. T-A-R-C-H-E-A. Trachea. Okay,
Treasure.
trachea.
Parang treasure na
Yeah,
treasure. Okay. Treasure.
yeah,
Treasure.
trachea. Okay, so lungs and trachea for now. Okay, inside the lungs there are bronchus, bronchioles, but we don't need it for now. Okay, so as long as you know the trachea, in layman's term we call it windpipe. Okay, W-I-N-D pipe, P-I-P-E. Like it's the tube for the wind to come in or for the air. Windpipe. Okay, but and the anatomical term is trachea. Okay, so again, just to summarize our topic for today, we talk about anatomy, we talk about the different systems. Okay, in the skeletal, if you cannot remember anything, at least remember the humerus and femur. Okay, your radius and your ulna. Okay, in muscles, if you cannot remember anything, okay, at least remember the site of injection because for us, it's very important clinical. Okay, so let me stop sharing. Okay, so for muscle, important to know the deltoid muscles because that's site of injection. The quadriceps